January is the month for prevention of birth defects. Things that we are supposed to do prior to our planning of pregnancy. We all know that January is the month for prevention of birth defects. So today we are going to learn about things that we are supposed to ensure so that our baby does not have birth defects. So some things we have to plan before pregnancy and some things we do during pregnancy. So the things that we are supposed to do prior to our planning of pregnancy, number one, we should ensure that our pre-pregnancy weight is appropriate. If we have any medical condition, then it should be treated and controlled before we plan our pregnancy. For example, if we have diabetes, then we have to treat diabetes, we have to control diabetes, and only after 3 to 6 months, diabetes being controlled, should we plan our pregnancy. Number two, we have to check whether or not we are immunized against rubella. Rubella vaccine is given as part of measles rubella or measles mumps rubella. If you have not received any of these vaccines, then it is very, very important that you take one of these vaccines, measles rubella or measles mumps rubella, to protect yourself against rubella. Rubella infection in the fetus put the fetus at grave risk of many worrisome birth defects such as congenital heart disease, cataract and deafness. So ensuring that the mother is protected against rubella would ensure that the fetus is protected against rubella and would prevent these very worrisome birth defects in the newborn. Third and also very important is taking folic acid. Folic acid has to be taken before conception. We have to start 3 months prior to the planning of the pregnancy. The dose is 400 micrograms per day, and once the pregnancy happens, you are supposed to continue the folic acid again 400 micrograms per day. Folic acid is important for the prevention of neural tube defects in the fetus. Neural tube defects are defects of the brain and spine in the newborn. They are very worrisome, like anencephaly. There can be encephalocele, there can be meningocele, meningomyelocele, spina bifida, and all these are very, very worrisome birth defects. But a simple intervention like taking folic acid, starting 3 months prior to the planned pregnancy and continuing it into the first trimester, is going to decrease the incidence of these birth defects by nearly 80%. During pregnancy, also we are supposed to ensure that we take care of some things. Among these, the first one that we must ensure is that we must register our pregnancy, and we must also ensure that the folic acid that we started prior to the pregnancy is continued during the pregnancy. Number two, we should ensure that we don't take any medicines, even if they are nutritional supplements, without consulting our doctor. Third, we should ensure that we don't get any X-rays or CTs done especially during the first 3 months of pregnancy. Very, very important, we should do no smoking, we should be drinking no alcohol, and we should also not be using any drugs during pregnancy, because all these have been shown to cause grave harm and birth defects in the newborn. So in this month for prevention of birth defects, I would like us all to ensure 2 things. One, that all our mothers receive rubella vaccination prior to a planned pregnancy, and number 2, that all our mothers receive folic acid 400 micrograms per day starting 3 months prior to a planned pregnancy and continue it into the first trimester. We are here at Amrita Hospital, Department of Pediatrics and Neonatology, to help you with any queries on the subject. Thank you.